Hey, let's talk about anemia.
But first, it's important to know about normal blood.
In red blood cells, the normal morphology is described using two terms, which is normocytic and normochromic. Normocytic means that the cells are of normal size. And normochromic means that the cells have the normal concentration of hemoglobin. And this how normal RBC should look like compared to various types of anemia.
Next, we move to the function of blood. The blood delivers oxygen and nutrients to, and remove wastes from the body cells. The specific functions of blood also include defense, distribution of heat, and maintenance of homeostasis.
That's it about normal blood. So, what causes anemia? Anemia is strictly defined as a decrease in red blood cell mass. Basically, only 3 causes of anemia exist. The 3 causes includes blood loss, increased destruction of RBCs, and lastly decreased production of RBCs. Each of these causes includes a number of disorders that require specific and appropriate therapy. Conditions that decrease oxygen supply to the tissues increases the rate of production of erythrocytes, as occur in situations like being at a high altitude, high oxygen demands among athletes, having a chronic respiratory disease, or the common one, anemia. Healthy bone marrow is essential for the production of erythrocytes. Normal erythropoiesis occurs in the bone marrow and is under the control of the hormone erythropoietin, which are produced by the kidneys and other growth factors and cytokines. Erythropoiesis is driven mainly by the hormone erythropoietin, which is a glycoprotein cytokine. EPO is secreted by the kidney. It is constantly secreted at a low level, sufficient for the normal regulation of erythropoiesis. Folate, vitamin B12, and iron have crucial roles in erythropoiesis. Erythroblasts require folate and vitamin B12 for proliferation during their differentiation.
Now, let's talk about pathophysiology of anemia. Anemia is generally results from blood loss, decreased red blood cell production, poor RBC maturation, or increased RBC destruction. In anemia of critical illness, the mechanism for RBC replenishment and homeostasis is altered by, for example, blood loss or cytokines, which can blunt the erythropoietic response and inhibit RBC production. Age-related reductions in bone marrow reserve can render the elderly patient more susceptible to anemia that is caused by multiple minor and often unrecognized diseases such as nutritional deficiencies that negatively affect erythropoiesis. Anemia in children are often due to a primary hematologic abnormality. The risk of iron deficiency anemia is increased by rapid growth spurts and dietary deficiency. Hemolytic anemia results from decreased RBC survival time due to destruction in the spleen or circulation. This is how anemia occurs.
Next is symptoms and signs of anemia. There are many forms of anemia, each with its own cause. Anemia can be temporary or long-term and can range from mild to severe. In most cases, anemia has more than one cause. See your doctor if you suspect that you have anemia. It can be a warning sign of serious illness. Signs and symptoms, if they do occur, might include fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness or lightheadedness, chest pain, cold hands and feet, and also headaches. At first, anemia can be so mild that you do not notice it. But symptoms will be worsen as anemia worsens. Let's talk about the investigations of anemia. The investigations of anemia depend on the types of anemia. First types of anemia is aplastic anemia. The investigations included blood test, that normally, red blood cell, white blood cell and platelet levels stay within certain ranges. In aplastic anemia, all three of these blood cell levels are low. Second investigations is by bone marrow biopsy. Next types of anemia is iron deficiency anemia. The investigations included blood studies which serum iron, total iron binding capacity and ferritin levels and iron stores in bone marrow. Next is sickle cell anemia. The investigations included genetic analysis and blood test checks. A blood test can check for the defective form of hemoglobin that underlies sickle cell anemia. In the United States, this blood test is part of routine newborn screening. But older children and adults can be tested, too. Next types is vitamin deficiency anemia. The investigations included complete blood count, CBC. Doctors will diagnose vitamin deficiency anemias through your blood tests that check for the number and appearance of red blood cells and the amount of folate, vitamin B12 and vitamin C in your blood. Next types is pernicious anemia. The investigations included complete blood count, CBC. Bone marrow aspiration that's showing erythroid hyperplasia, crowded red bone marrow, with increased number of megaloblast but few normally red blood cells. Next is genetic analysis. Urinalysis and Schilling test.
Eating a diet with iron-rich foods can help treat iron deficiency anemia. Good sources of iron include meats, fish and leafy greens. Iron supplements can also be taken over several months to increase iron levels in the blood. A blood transfusion is a safe, common procedure in which blood is given through an intravenous line in one of the blood vessels. Transfusions require careful matching of donated blood with the recipient's blood. In clinical settings, medication may be given to help the body make more red blood cells or to treat an underlying cause of anemia, and if come to a worse situation, surgery may be done.